would like to start with, since AMR is a subject that you talk about a lot, you're spreading awareness, you were in Seoul recently working on that. So let's begin right away with that itself. It is being called a silent pandemic, yet we don't hear such open discussions on it. So what's your take? What do you want to say?
Thank you, Kalpana. And at the outset, I would like to thank the organizers for giving space to antimicrobial resistance and also the related health topics which you plan to cover in this side chat, because it is a very important area for us. It was always very important. I have been working in this space since 1999, and but unfortunately, at that time, a lot of countries' resources and attention was towards containment of HIV/AIDS, as you would recall. We were going through a very bad time as far as HIV infections were concerned. And then there was this report which was published in 2010 and 11, which kind of claimed that India is the hotspot of drug-resistant infections. And I think that was too harsh for the country to take, because antimicrobial resistance is an important area, but it exists in every country, it exists in every healthcare system. So in that way, India is not very different, but the fallout of that particular report was that India put together a national program on AMR. So now I think we have made a lot of progress. For the audience who are not aware about antimicrobial resistance, I would just like to give a brief introduction to it, that we used to use a different set of antibiotics 10 years back, 20 years back. You would recall taking Septran for a sore throat. But now that medicine has disappeared, and even your sore throat doesn't get cured with that medicine, because the bugs that cause your sore throat or the other infections, they become resistant to the antimicrobials which we use routinely. For example, everyone is popping norfloxacin these days for any loose motions or any loose stools. And now the situation is that the norfloxacin also has become ineffective in treating diarrheal infections. So that's why we should be using antimicrobials with caution, whether they are antifungals or antibacterial medicines, because emergence of antimicrobial resistance is a direct consequence of overuse of antimicrobials. So whenever we pop a drug, especially antibacterial drugs, which are antibiotics, we should be very cautious about it. And one thing we should remember, that antimicrobials are not active against viruses. And that is exactly what happened during COVID time. Yeah. Because we did not have any specific treatment for COVID, everyone was popping azithromycin, Monosef, so many brands were, drugs were misused. So that's why post-COVID, actually, there has been a lot of focus, and very rightly so. The reason we call it silent pandemic is because if you have a case of polio or tuberculosis or your COVID for that matter, system is notified. Right. But how many drug-resistant infections are notified? Not even one. So there are people who are dying from sepsis because of drug-resistant infections that are acquired in the hospital, but they are not notified. We still do not, in spite of working in AMR space for last 10 years, we still do not have a disease burden estimate for the entire country for AMR, and that is precisely the reason why it is silent. Apologies for a long answer.